I feel that they do a unique job. They can potentially reach every single person in Glasgow who has a life-limiting illness.
My name's Shelley Baden and I'm one of the Macmillan nurse facilitators working in the primary care palliative care team. There's 4 nurses, Christina, Annette, Christine and myself, working across Glasgow supporting district nurses, upskilling them in the best care, evidence-based care that they can then deliver to their patients living at home.
The Macmillan nurse facilitators help the district nurses by coming out to the clinical practice with us and educating us on cancer and palliative care.
If the team wasn't there, we wouldn't get the education that we do get in palliative care. We wouldn't have the resource and expertise and advice from them that is invaluable.
An average day is usually the team trying to meet together and plan what we're going to be doing that day. So it might be that we might be visiting a health centre with district nurses, teaching some technical care. We might be doing a teaching session with GPs in the afternoon about breaking bad news. We might be teaching other district nurses about end-of-life care, how to introduce sensitively the DNA CPR forum in a patient's house. That area of Glasgow, there's areas of extreme wealth, but unfortunately there's also areas of extreme poverty. And an example would be if you live in the East End of Glasgow, the average age for a man to survive would be approximately 58 years. But if you live in Bearsden, which is less than 6 miles away, you would hope to survive until you're about 82.
During the summer months, when people that they would normally be teaching are on summer holidays, they don't sit back on their laurels. They actually all go out into clinical practice and spend at least 4 weeks working as district nurses again, thereby keeping their clinical credibility absolutely top-notch.
We've all worked immensely hard to make sure that what we do rolls out and is maintained. When you see the benefit to the patient about what good nursing care and what good palliative care can do, and I think sometimes I feel a bit proud that our team helps provide that. We help to upskill these nurses so that these patients can die at home and not in hospital.
They're not a team who like to hear the word no. In fact, to this team, no is just not yes at this time. They will find a way round that.